Welcome to COPD Education Stem Cell Workshop. And in this workshop, I'm going to go over how stem cell therapy is helping people suffering with COPD breathe better again naturally. COPD is a terrible disease that claims the lives of over 150,000 Americans every single year, making it the top 3 killer in the US. And one of our founders at National Stem Cell Institute, or NSI, has a personal experience with this, and he is actually going to share this next. He recorded it as we were getting the research together for this workshop and got very emotional as he was brought back to a few memories.
I just want to start off by saying I'm one of the founders of NSI, and I want to kind of tell a story that's real near and dear to my heart. My grandmother, who helped raise me growing up, passed away on my 19th birthday from COPD. I seen the struggles that she went through over the years, and I see really what can this do to a family. It got to the point where, she had a hard time from leaving the kitchen table to go to the bathroom and back. And this was really devastating. I lived with her for 4 years after my grandfather passed away when he was 15. And it really took a toll on me as a child. And I always remember, I always was praying, please help her heal. But the only thing that she would ever get was the inhalers, then oxygen, and she was on a lung transplant. And unfortunately couldn't make it to the lung transplant. Most people don't. And this was, 25, 30 years ago now. I'm here to tell you that if you're suffering or know anyone that's suffering from COPD, today's current treatment options are no different than was for my grandmother 25 to 30 years ago. But I'm here to tell you, it's 2019 and there is a treatment option that's really giving people their hope back and extending their lives and the quality of their lives. And that treatment is stem cell therapy. I personally feel that every COPD patient should have access to affordable stem cell therapy, and that's our goal.
What you will learn in this workshop is what regenerative medicine is and how it works, the science behind stem cell therapy, the best sources of stem cells for COPD specifically. There's many sources, so we're going to go through those, and also how stem cells can help heal the lungs. And I'm going to share the research with this to you so that you understand it at a basic science level. A little bit about NSI, or National Stem Cell Institute. I just want to show you we've been featured in many national publications like Forbes and Entrepreneur magazine. Here is our global network around the world, making NSI have one of the largest regenerative medicine networks, including stem cell therapy, that you can access in the entire world. And as you'll notice here, we have over 200 reviews with an average rating over 4.8 stars. So this just goes to show you people review our clinic because of the results that we get. In addition, we have over 213,000 follows on Facebook. And if you do not subscribe to our Facebook, I would encourage you to at NSI Stem Cell to stay up to date with the latest research and facts about stem cell therapy. So what exactly is COPD? Well, this is the easiest definition that I could find. COPD is characterized by breathing disorders that make it hard to breathe. So we're going to go into the science of this and then how stem cells can actually make it easier to breathe again. But let's go ahead and take a look at a couple websites. And I also want to show you a testimonial right off the bat, just so you know that this is actually possible.
My name is Dick Roberts, and I came to get some stem cell treatments. I was experiencing shortness of breath, and when I do things, I got short of breath real quick. And since the stem cells, my breathing has improved, and I'm able to do things and not become tired as quick. My golf game has improved. My buddies didn't like that, but I think the stem cells will help me, and I'll probably have another treatment.
COPD. So what is COPD? Well, this is right from the NIH, the National Heart, Lung, and Blood Institute page. And this is where I got this definition from. COPD is right here, progressive disease that makes it hard to breathe. Progressive means the disease gets worse over time. So we can see here that cigarette smoking is the leading cause of COPD, but not everybody with COPD has smoked. So up to 25% of people with COPD never smoked. So there is a rare genetic condition that we'll kind of go over later, but I just want you to know that it's essentially a disease that makes it hard to breathe. If you have it, you know this. If you don't, this is what it is. How is COPD treated in the standard medical system? Well, this is taken from the American Lung Association's website, and I just wanted to show you that it is treated through medications. So by taking the right medication right here, you can breathe better, do more of the things you enjoy, and have fewer flare-ups. Now, for some people, this might work, but for a lot of people, they say, despite the medication, I cannot breathe better, I'm not doing the things I enjoy, and it's getting worse. So this is where pulmonary rehab comes in. In addition, you have supplemental oxygen, or even surgery. So sometimes they cut part of the lungs out, which, you know, eventually you're going to have less lungs to breathe. But for people who have tried these things or don't want to have drugs, surgery, or oxygen, then stem cell therapy is typically a great option. Not everyone is a candidate, but a lot of people are, and that's what this workshop is about. So I'm going to explain the science, but I wanted to go over the standard treatment, and notice you will not see stem cell therapy in here because the American Lung Association and most pulmonologists just have not seen the research that I'm going to show you. Eventually it will come around, but this is brand new evidence, and if you're a person who wants to get on board and get the thing that is helping people stay away from drugs and even get off their oxygen, then you're really going to want to pay attention. A few important facts about COPD that come right directly from the Merck manual, which determines the outcomes of care and how primary care physicians treat COPD. So at any rate, this is a very excellent source for researching it, but the treatments in here are going to be limited to the ones we just talked about. So at any rate, in the US, I'm going to highlight this here, there's about 12 million people who have COPD. It's the third most common cause of death, accounting for over 150,000 deaths in 2015. And from 1980 to 2000, the number of deaths to COPD has increased 64%. So what we're seeing here, and also 97% of all deaths occur in people older than 64. And it affects women often more than men. So what we're seeing is the amount of death rate is rising. So obviously the current system of treating COPD is not really getting better. The outcomes are getting worse. So we have to look to other things. And this is stem cell therapy. I want to take a second to teach you a short anatomy lesson so you know exactly how COPD works and what it actually is. So in your lungs, you have little small branches of the airways called alveoli. This is a system of tiny air bubbles that holds the air, and it's connected with different vessels called capillaries. So what you have here are the little bubbles that collect the oxygen you breathe. They also hold the air that you breathe out. Well, in this exchange, the capillaries, or these little blood vessels here, take in oxygen and they take out carbon dioxide. So this allows you to breathe properly. I mentioned capillaries on the earlier slide. So what is a capillary? Well, a capillary is the smallest blood vessel in the body, and these are responsible for transporting blood to organs, to muscles, to all the vital parts of your body that need blood. And like I said, they carry oxygen. So the issue with COPD, and you'll know this if you have it, the reason people are fatigued and tired and things just don't work right and they kind of get worn out easy is because these capillaries are not getting the oxygen that they need to. In addition, the organs and muscles that the oxygen is needed for is not getting there either. So if you get dizzy or have brain fog or all these different things when you have COPD, the reason why is because you're not getting oxygen to your brain or muscles. And to drive this point home, I just Googled, capillaries and alveoli, and you can see here on the top section that it says the alveoli are covered in capillaries. Here's a picture of the capillaries in action. So what you're going to see is the capillary, which is this tube with blood vessels moving through it surrounding the alveoli, or the air bubble. So as you breathe out, carbon dioxide is breathed out while oxygen is breathed in. This must work properly to breathe right. Let's review the 3 types of COPD before going on, and before I tell you how stem cell therapy can actually help these types. So the first type is emphysema here. Right here from Encyclopedia Britannica, we're going to look at emphysema, and you can see highlighted right here that lungs affected by emphysema show loss of alveolar walls and destruction of alveolar capillaries. So the root cause of emphysema is destruction of the alveoli, those little air bubbles, and the capillaries on them. So if you can address the root cause, which stem cell therapy does, as I'm going to explain the science here shortly, then you can reverse the condition, or at least partially reverse it. And most people are able to get stem cell therapy. Not everybody is a candidate, but I'll go into that as well. Okay, so let's break this down. On the left here, we have a healthy alveoli. So remember earlier I said these are like little bubbles in the lungs that hold the air. Well, you can see here on the left, they are nice separate bubbles. So let's think of them like balloons now. And these balloons are all held close together. Reminds me of when I was a kid and I would throw a dart at the fair at this board with balloons on it. Well, at the beginning of the game, they were all connected, all the balloons, there was no open space. Well, as I threw the darts and popped the balloons, then they started to disappear. Well, this is what happens in emphysema because the alveoli, or these little bubble balloons, start to get popped. And then the issue is that the balloons do not hold the airway open, so the airway starts to collapse, and then you get these destroyed alveoli, and that really impacts and it affects the capillaries as well. The next type of COPD is chronic bronchitis. Now we're going to take a look at bronchitis, and this also comes from the Encyclopedia Britannica. And we see here that bronchitis is the inflammation of all or part of the bronchial tree, the bronchi, through which air passes into the lungs. So the bronchi are a fancy word for saying the lungs airways. So we're going to go down here, and we see acute bronchitis is bronchitis that only lasts several days to several weeks. However, if it goes on longer, it becomes chronic. So this creates, right here it's highlighted, irreversible damage to the bronchial walls and thickening. Now, this says irreversible because the people who wrote this have not heard of stem cell therapy yet and have not looked at the research, because once you look at the research, you can see that it may actually be able to be reversed. So this should say it causes potentially irreversible damage. Now, this depends on every person, because we have had people who have had this that actually end up breathing better. So it's not just magic. They end up breathing better because the science tells us that that can happen, and that's what I'm going to share with you later. So this really makes it easy to understand bronchitis. If you look at this diagram here, on the top, you'll see that we have a healthy bronchiole, or the healthy airways that the lungs use to get air in and carbon dioxide, or the air you need to breathe out of them. So you'll see here that this is a nice and wide open vessel because there's not a lot of mucus. There is a little bit that serves to trap harmful bacteria and dust and different things you breathe in. But now you'll see below, in the case of bronchitis, there is mucus in between these layers of the bronchioles, or the air tubes in the lung. So this narrows them. And you'll see here that the third type of COPD, or asthma, is actually not real COPD. This does have a narrowing of the bronchioles and different airways in the lungs, similar to chronic bronchitis. However, it is not considered COPD, and we find this fact out right from this government website that says there's only 2 types of COPD. A little bit more about COPD itself. and what it actually is doing. So I wanted to go to the research here. This is the American Journal of Stem Cells, and this is about how stem cell therapy helps people with COPD. So I just want to scroll down though here before we get into the actual stem cell therapy itself, and we have to understand how airflow is limited in COPD. So right here, in COPD, airflow limitation is resulted from two mechanisms. The first is the loss of elastic recoil and the obstruction of small airways. This means that those air bubbles do not operate properly, so they cannot recoil, aka they do not fill up and they do not deflate properly. Instead, they're just kind of flaccid, loose, and they cannot get air in and out of them properly. So the second way is the thickening of small airways increases the airway resistance and results in air trapping. So not only can they not get air out of the lungs and into the lungs, but air actually gets trapped in the lungs, and this results in low blood oxygen saturation levels. So this is why people have an O2 sat in COPD of usually somewhere around 90, 91, 92. Then they have to go on oxygen to get that up to a normal person's O2 sat rating. Here is a close-up of the lungs in someone with COPD, and red blood vessels are moving in and out, and you can see these little red and blue dots being exchanged. That's oxygen and carbon dioxide going in and out. Well, in COPD, people can't get this in and out properly, so you'll actually see as people breathe in and out here, these should expand a lot, and they're barely expanding. So now, here is the exciting news. How do stem cells heal the body? MSC, as you'll see at the top, is a type of stem cell. So we're going to be talking about a few types of stem cells. So first of all, MSCs naturally heal the body because they primarily affect the capillaries. They can turn into other tissues as well. We'll go into those different aspects of them later. But I really want you to understand we have to be able to repair the capillaries on those little air vessels and in the bronchioles, so the lungs can get oxygen into the body better. So this is why the capillaries are so important, is because of this paper right here. So this was a 2003 paper in the European Respiratory Journal. So this information, by the way, has been known for a long time, but this really puts it all together. So if we scroll down here, and there's a few facts from this paper I'm going to go over, but for now you need to know one thing, and that it shows right here, in addition to perivascular inflammation, the pathology of vessels in COPD includes thickening, muscularization of arterioles, loss of capillaries and pre-capillary arterioles, and vascular congestion and stasis. So this sounds really fancy, but what you need to understand is that COPD is characterized by the damage of the vessels, which most people know, but really here the main point is the loss of capillaries. And this is what most doctors don't tell patients, because before stem cell therapy they did not know how to heal the capillaries. Well, now we know how, but if the loss of capillaries can be reversed and capillaries can be regrown, then what's going to happen? Well, one of the reasons that COPD develops is going to disappear. So you can see it's imperative that the capillaries must be repaired because that's what gets destroyed in COPD. But there's awesome news. In the body, naturally, in the absence of disease or pathology like COPD, there are things called pericytes that live on and reside on the capillaries. Now, what is a pericyte? I need to take a second to explain this to you also, because this pericyte and MSC relationship is so important, and a lot of clinics do not teach this to people. And the reason why is because most people do not understand this yet, as it's fairly new research. So you can see here that MSC, an injury drugstore, and this was written by Arnold Kaplan, who's a doctor and PhD, and he's actually the one who discovered mesenchymal stem cells. So if we scroll down here, we're going to scroll down to the main point of the paper, and you'll see here the pericyte, And right here, he discovers these and other observations allowed us to speculate in a commentary in this journal that all MSCs are pericytes. So he's saying that these MSCs are pericytes, aka they are inactivated stem cells that become activated when injuries occur. But I'm going to explain that in a second. You need to know, if there aren't enough pericytes, then the body is not going to heal naturally, and this is what happens in COPD. So these pericytes that live on the capillaries get activated with injury or inflammation. Now, what is that for COPD? Well, let's take a look at this list here. The first major type of inflammation that occurs in the lungs is smoking. So this could be from you smoking or from secondary smoke. This is how cigarette smoke affects the lungs. Other smoke as well, so firemen, people who just inhale smoke from different factory jobs and things. So anyways, you have healthy lungs here in the healthy alveoli. So you'll see these big, nice air bubbles in the lungs, or little balloons. Well, when you have cigarette smoke or any type of smoke come into the lungs, harmful particles get trapped in the alveoli, such as arsenic or these different poisons in cigarette smoke and different types of smoke. This then triggers an inflammatory response in the body. So inflammation comes to the alveoli and it sends little particles there to help clear up the damage. Well, when this happens too much, too long, these inflammatory particles actually end up popping the air balloons in the alveoli. So these are like those darts on that fair game where you're throwing them at the air bubbles. These little darts or little healing chemicals come to the alveoli or the air balloons of the lungs, but when there's too many of them, they actually end up popping them, and then you get these large spaces that are filled with things like carbon dioxide, because now it can't get out because they are collapsed and all popped. The other types of injuries and inflammation that can happen to the lungs leading to COPD are lung irritants like chemicals or different fumes. So people who've worked with things like gasoline a lot, or painters, construction workers, or people who are in factories, family history with genetic disposition, specifically the AATD gene. So this is very popular now as genetic testing to see what things people are susceptible to. And the earlier that you can actually treat these conditions, the better results you're going to have. Hey, if you have COPD and you have kids with COPD, they could get tested for this to see if they are going to be disposed to it. In addition here, we have a history of respiratory infections as a child. So if you are a child and you're sick a lot, you can actually be predisposed to COPD. Back to this chart here, these common injuries or inflammation responses that happen to the lungs stimulate dormant stem cells into action. So the pericytes on the capillaries turn into activated stem cells. The stem cells reproduce, and then they go to work healing the lungs, which I'm going to explain how that works here in a few minutes. But certain tissues have an abundance of stem cells on the capillaries, such as healthy tissues or tissues that are not chronically insulted by irritants like cigarette smoke. So when these things go on too long that I just went through, it destroys the pericytes on the capillaries and the lungs are not able to heal properly. So what would you have to do? Well, you'd have to replace the stem cells on the capillaries so that they can heal again. And this is exactly what evidence-based medicine is combining the best clinical evidence with research, combining the two. And let me break this down. That means combining what has worked, treating patients, and what the research says work. You combine these two things, that is what true medicine is. And this is a research paper that I got that definition from. And I just wanted to point this out. You can see it here highlighted in green. But the reason I even bring up this research paper here is because we use research at National Stem Cell Institute for all of our protocols. And this is why we're able to get the results we do with people with COPD. We help people get off their oxygen, as you have seen in this testimonial, and you'll see in a few more testimonials. We help people walk around and breathe better again. Now, how can we do that? Is it a miracle? Well, it seems like it to the people getting this treatment, but really it's because we are using science to help heal the body. The field of regenerative medicine encompasses a lot of different things, and the point of it is to help repair or regenerate tissues in the body. So the alveoli, the injured lung tissue, those bubbles that gets popped, and the capillaries, the little blood vessels that attach to the alveoli. Now note here, you'll see in green that stem cell therapy is a part of regenerative medicine. Some clinics tell people that stem cell therapy is regenerative medicine. However, true regenerative medicine includes stem cell therapy, but it also includes other things like PRP, dietary advice, anything possible to help you breathe better again. Because if you want true healing, doesn't it make sense that you have to do every single thing that science tells us works in a combined system? That's how you get results. So stem cells are the starting material for all tissues in the body. They are found at all stages of development. They can continuously reproduce themselves while maintaining ability to differentiate. This means they can form copies of themselves, but turn into different types of cells, not all the same type of cells. So this is powerful because some could turn into alveoli cells or the air bubble cells. Some could turn into capillary cells. And also, many are located on the capillaries themselves. So it's super important to heal the alveoli and capillaries to get the lungs to be able to breathe better again. Well, it's because they have enough pericytes and stem cells to actually heal those holes. Or someone that breathes in minor amounts of irritants or smoke but has a genetic predisposition is not going to have enough stem cells to heal those holes. Well, what we can do is help replace some of those stem cells and different things to help repair the holes. This then leads to healed tissue. So it's important to minimize the things that decrease the healing response and increase the things that we can. Well, the healing response decreases with age. Now, we can't do anything about that, but it also decreases with trauma, repetitive trauma, and inflammation, which are all characterized by smoke and different irritants that cause COPD, and disease like COPD itself. So what do we have to do? Well, we're going to have to eliminate the irritants. So the smoke, maybe the chemicals, anything we can help people to do to reduce and identify as a trigger, we are going to do so that they can heal. And then we are going to increase their healing response by stem cells, PRP, cytokines, exosomes, and different supplements to help the walls of the lungs rebuild naturally. So I want you to know it's really important to combine all of these things backed by science or evidence-based medicine, and this is how we get the results we get with people and help them to get off their oxygen and breathe better naturally again. You should have this memorized by now, but if you don't, I just want to summarize it. Healing requires adequate blood flow via capillaries. Capillaries contain the stem cells to repair the body, and they decrease with age, injury, and inflammation. So for our older patients, they might need more of them. Or for our patients who are sicker or in worse conditions, such as they're on oxygen, or whatever the case is, we will fit the treatment to the person, their age, and all these things, and that is what we do through our consultations. But at any rate, I want you to know that the MSCs on your capillaries are similar to your body's own pharmacy. So these capillaries decrease as you get older, and this is from one of the founders of stem cell therapy himself. So I just want you to know this is evidence-based medicine.
Hi, my name is Terry DeLuca. I came in for COPD. I had trouble breathing. Every little thing made me out of breath. Just walking, mowing the lawn, etc., I'd be out of breath. I've had my treatment about 30 days ago, and I'm already feeling much better. I was able to mow my lawn on one of the hottest days and with a push mower and not be out of breath not once. And I'm feeling better and better every day. I've been able to lose some of the weight that I gained from quitting smoking 2 years ago, and I'm just feeling like a whole new person.
I just want to clear this up because people often have the question, where do these stem cells come from? Are they coming from babies? Well, there are two different types of stem cells. So there are adult stem cells and embryonic stem cells. Adult stem cells come from adult tissues These are even endorsed by churches and religious institutions like the Vatican. They've been studied since the 50s, and a lot of people know stem cell therapy as a bone marrow transplant that cancer patients get sometimes. So this is a stem cell procedure, and it's been in use since the 50s. They can only form certain cell types. This is really important because embryonic stem cells, as we'll see, can form many cell types, but adult stem cell therapy, getting a dose of stem cells is safer than taking an aspirin a day. So taking an aspirin a day has more harmful side effects than getting stem cell therapy. And embryonic stem cells, on the other hand, come from aborted fetuses, which causes controversy. So this is why President Bush banned them in 2001. And these can form any type of cell, like cancer. So they're unstable and safe. We use adult stem cells. We do not use embryonic stem cells at NSI. There are several different types of adult stem cells, and the main two classifications are ones that come from you, which we call autologous here on the left, and those are the ones in blue. And then there's the allogeneic, or the ones that do not come from you. So these are here in the red and purple. So the ones that come from you, what you need to know, there's no chance of rejection once they're administered to your body because they're your own cells. And adipose tissues have the most amount of mesenchymal stem cells per dose, a specific kind I'm going to review next. Bone marrow has the most hematopoietic stem cells per dose, another type I'm going to review. Well, the ones that are donated, such as umbilical cord blood or Wharton's jelly, which is umbilical cord tissue, there actually is a chance your body will reject it because they're not your own cells. And these have a low amount of mesenchymal stem cells per dose and effectively very little living stem cells. So we use any type that we need to, but primarily we want to use the type that are going to be the most potent and have the most stem cells. So what is a mesenchymal stem cell? Well, these are multipotent cells, which means they have the ability to turn into different types of cells, such as alveolar cells. Remember the little bubbles in the lungs? These can turn into those. They can turn into lung epithelial cells. These are the cells that coat the lungs linings, and these get damaged through disease and things like cigarette smoke. And they can even turn into vascular or blood vessel and capillary cells or endothelial cells themselves. To prove this, I wanted to show you right from research, and this is a 2018 paper. We actually looked at this one earlier, but I'm going to show you that stem cells have the ability to turn into different lung cells, and there's a lot of great information in this, guys. In fact, if you want, you can look this paper up on pubmed.gov for those of you who are research nerds and love to read it yourselves. Just look at the title and then you can look it up. But right here, this is the key point. MSCs also have the ability to differentiate into alveolar cells, lung epithelial cells, vascular and endothelial cells. This is where I got that information from, and I wanted to show you this is based on science, not an opinion. And some people think, well, if it was that easy, why wouldn't my other doctors or pulmonologists recommend stem cell therapy? And typically it is because they have not read this research. Like I mentioned, you can see down here, it was just discovered in 2018. So this is very new information, and this has been going on for a while, but the actual mechanisms of how they repair has just been discovered. And a lot of doctors like to see this research, and they always say, well, I want to see the research before I'd ever recommend it. Well, here's the research. They can turn into different types of cells, and this is how stem cells repair lungs in people with COPD. The other type of stem cell is the hematopoietic stem cell. Now, this type of cell specializes in angiogenesis, or the regrowing of blood vessels. So mesenchymal stem cells can do this as well. So they both can regrow blood vessels, but hematopoietic stem cells just have a very good way of doing this themselves. So in COPD, the way we do it is we give people mesenchymal stem cells from adipose tissue and hematopoietic stem cells from bone marrow if those resources are available. Now, if they aren't, we will also make means with other types of stem cells, but for most people, we give them both types because we want the lungs to be able to repair all the damaged cells and to be able to regrow new blood vessels. For from the same paper that I explained what mesenchymal stem cells can do, I just wanted to go ahead and share a fact with you about bone marrow stem cells and what happens to those in people with COPD. So you can see right here, in a recent study, it was shown that cigarette smoke exposure caused the depression of bone marrow hematopoietic stem cell function. So when people are smoking, it actually depresses or makes the bone marrow hematopoietic stem cells in people's bodies not work correctly, and they're not able to repair and regrow the capillaries in people with COPD. So it's really important that if people want treated, and we will not help anyone that does not does not stop smoking, because you have to stop smoking for the stem cells to work. We're not just telling people to stop smoking just to be the bad guy. We're telling people this because this is what works, and this is what science tells us heals somebody with COPD. I want to point this out. This is a common misconception about PRP. PRP is very helpful in helping people with COPD breathe better again, but it is not stem cell therapy. And just so you have a visual, PRP, because people say, well, what is PRP? Well, PRP is blood that is taken from the patient, and then the red and white blood cells are separated from the platelet-rich plasma. So effectively, you get a very concentrated amount of platelets that have amazing healing factors to help people with COPD breathe better again. And this is the paper that I got that fact from. And it talks about mesenchymal stem cell administration in patients with COPD. State of the science. This was written in 2017, as you can see here. So we're actually going to scroll down. There's a lot of great information in this paper as well that we use in our clinics, but there are just some clinics out there who only use PRP and COPD treatment in the field of regenerative medicine, and that is just not what the science says works, because right here you can see the novel approach of adding PRP to adult stem cells was shown to have promising benefits in regenerative medicine from studies. So this is not saying PRP alone, it's saying adding stem cells to PRP helps regenerate the lungs. And I just want you to know as well that as long as stem cells are giving, PRP can be used afterwards to help the lungs regenerate, but PRP alone without any stem cells given to the patient is not going to be as effective as using both of them combined in conjunction. How do stem cells actually help heal the lungs? Well, I told you I was going to go through it, and now we're going to go through the exact mechanism. So, stem cells can home to the lung tissue. And why is this important? Well, it's important because the way stem cell therapy is administered to people with COPD is through an IV. I wanted to show you this again from the research, and we are so research heavy here because it just proves that what we are saying works, and this is why we get results because we follow the research. So this comes from that same paper, American Journal of Stem Cells, from a 2018 article, and this talks about the homing and mechanism of action. So this proves that when injected intravenously, MSCs can accumulate in the injured regions. The damaged lung released some cytokines to attract circulating or bone marrow derived MSCs and promote lung regeneration. So right here it says that when injected intravenously, the stem cells home to the injured areas of the lungs to heal and repair them. After they are given into the body through an IV dose, these stem cells home to the lung tissue, and remember, they know what types of cells to turn into, and as you can see here, once these are in the lungs, they are going to begin to repair the lungs. So here we have a left and a right lung, and you can see that the lung on the right was a little bit more damaged, so there are going to be more stem cells still in that lung as it's healing as opposed to the left. So these stem cells are smart. They know which lung to go to, which one's more damaged, which one needs more repair, and they're genius healing cells. It's how our bodies naturally heal. The second way stem cells help heal the lungs are because they have regenerative properties. Now, I already mentioned this earlier, and I showed you the research that showed you they can turn into different types of cells the lung needs to repair, and as well as the capillaries. But I want to point this slide out because stem cells can also turn into other types of cells that the body needs to repair, and there's all these different organs. And we actually treat a lot of conditions, but we are focusing on the lungs here. So I want you to know they can repair other types of tissues as well, because people will say, well, I thought it was for knees, or I thought it was for backs, or I heard that someone got it for MS. This is true, but the stem cells are going to home to the areas your body needs the most, and it also depends on where they are injected or applied. When we do a knee procedure, they're given into the knee. So people say, well, if it's injected into my bloodstream, isn't it going to go everywhere where it needs repair? Well, it's only going to go to the areas that need the most repair. In the case of COPD, these are going to go right to the lungs. The final way stem cells help heal people with COPD is because they can stimulate angiogenesis, or the creation of new capillaries. Speaking of angiogenesis, I want to show you a fact that happens in people with COPD and the angiogenesis. So this talks about COPD, and it's a paper here that was written in 2013 in Lung Cellular and Molecular Physiology. Sounds pretty fancy, right? Well, this is the main point right here, is that vascular change, here I'll just go ahead and highlight it. Vascular change in angiogenesis is an integral part of the pulmonary inflammatory response. Okay, we know this. We need to get angiogenesis, we need to regrow capillaries. But cigarette smoke not only causes inflammation and direct injury to the lung tissue, but also inhibits compensatory angiogenesis and thus impairs repair and adaptive mechanisms in a smoker's lung. So we can see right here that cigarette smoke or other toxins in the lungs actually impair compensatory angiogenesis. This means that in a person who does not smoke cigarettes and does not have COPD, their lungs can regenerate blood vessels on their own. But in people with COPD, this cannot happen. So we must remove the insults, which are the cigarette smoke or everything that we can, and implement ways to regrow the blood vessels, which I'm going to go into right now. So that research is very exciting because we can see that stem cells have the ability to regrow the capillaries that get damaged on those little small air bubbles called the alveoli. So this is how they actually do that. It's because stem cells are like little natural pharmacies. Remember I mentioned that earlier? Well, what does that mean? Well, it means that they secrete the body's own natural medications in the time of need. So one of these is VEGF. So this is this little purple oval here. And VEGF is very special because it stimulates the production of blood vessels. And this is what VEGF is. You can see here, I just Googled it. VEGF is a protein that signals the body to make blood vessels. So if we need new blood vessels and VEGF is present, it's going to tell the body, hey, create blood vessels. So when the stem cells release the VEGF, it tells the body, create new blood vessels there, and the stem cells can help do that themselves as well. But other cells even come to the area to help repair and rebuild the blood vessels. Regarding VEGF, this is another imperative fact about it in people with COPD, and this comes from that paper that we talked about earlier, the European Respiratory Journal paper. So this is saying that, of course, angiogenesis is inhibited and there's a loss of capillaries in people with COPD. However, we also see here recent work describes apoptosis of endothelial cells, which means cell death, and decreased expression of VEGF in one of its receptors in lungs from patients with emphysema or COPD. So what this tells us is that VEGF is decreased in people with COPD. So we need to replace the things that create VEGF, which are mesenchymal stem cells, and then this can be replaced in people with COPD, and it's going to cause the body's lungs to regrow capillaries on those little air vessels. But the good news is that stem cells can secrete different things like VEGF amidst other natural drugs to help heal the body, and this is the proof for that. And this comes from the paper that Arnold Kaplan, the founder of stem cells, wrote. So it says right here, we support the model that MSCs are clinically active at different tissue sites. The MSCs are pericytes that can be isolated from different tissues. And then right here, MSCs, let me re-highlight this, secrete large quantities of a variety of bioactive molecules as part of their locotrophic and immunomodulatory activities. So this is a really fancy way of saying that stem cells secrete different chemicals like VEGF, and this is why they are a great natural pharmacy inside the body. When the VEGF binds the EC or EPC cell, which is just an endothelial cell or epithelial cell, basically they're just the cells that line the vessels in the lungs and the lungs themselves. This stimulates the production of the new blood vessels, as you can see here. So remember when I said if you can help repair the little air bubbles in the lungs and the vessels and the capillaries, well, stem cells do all of those things. PRP helps maximize their effectiveness, and in addition, there's a couple other things that can be put into the process, such as different supplements to help the body even repair better. So we combine all of this into a proprietary process that we use to help heal people with COPD, and a lot of them get off their oxygen again. So I want to go ahead and share with you one more story, and then I'm going to tell you how you can figure out if this would work for you or someone that you know.
Hi, I'd like to introduce myself first. My name is Robert Matchett. I'm a stage 4 COPD patient. It started out in 2012. I went to the hospital. I was admitted for 5 days, found out I had COPD. In 2017, I had the opportunity to do stem cells. It worked for me. I was on oxygen 24/7. I was at the point where I could barely walk. We did stem cells the first time, and everything drastically improved. I was speaking at a few seminars and talking to the doctors, and they realized that I wasn't breathing as well as I should be. So we did the stem cell therapy for a second time. The second time was truly beneficial. I was at the point in 2016 before I had the stem cells to where I was going to the emergency room about every 21 days with a flare-up by ambulance. It's not any fun. And it was at that point the head nurse told me, he says, "You're probably not going to be with us too much longer. We feel you're probably prednisone dependent." So I changed quite a few things, lifestyles, where I lived, and stem cells. And I'll tell you, I haven't been back to the hospital in an emergency situation like that since. So I'm very blessed to be alive, and on NSI's part, they've just done wonders. I would recommend it to everybody that's suffering from COPD. It's not a cure-all. It's not going to be like you're going to wake up the next morning and, oh, great, everything's back to normal and back to... It doesn't work like that. It slowly rejuvenates tissue inside your lungs. And it makes life a lot more bearable. So if you are suffering from COPD, I would suggest that you do this. Get in touch with them. There's no amount of money you can put on health care or taking care of yourself. You could be rich, you could be dirt poor. That doesn't matter. There's not enough money that can make you 100% again. But this will help you. Very blessed to be alive. And if you are suffering from COPD, get this one done.
Well, that is it, guys. Thank you for attending the COPD Education Stem Cell Workshop. And if you are someone who wants help and is tired of suffocating and wants to breathe better again, it's very easy to find out if we can help you. The easiest way, honestly, is just to call the office at the number on the screen, or you can visit nsistemcell.com and chat with someone on there as well. But, we have people that travel to us from all over, and a lot of people, as you've seen, are able to get off their oxygen. So we're just passionate about helping people breathe better again, because it really impacts all functions of life. So thank you again for watching this, and please share it with anybody you know that's suffering from from COPD, because we're on a mission to help people breathe better again that have COPD and really help get rid of this disease that is just plaguing people across America and across the world. So thank you and have a blessed day.